OB-GYN Dr. Jaimie Seeman, okay? You may have looked at her, Dr. Fit and Fabulous, on Instagram. She's doing great work. Doc, it's good to have you. Dr. Potter, thank you for joining as well. Dr. Potter, appreciate you putting it out there. Jaimie, I appreciate you bringing it to my attention. Dr. Potter, the question is, was this the 1 in a million? Was this just one rogue person that did this and that it got fixed and everything was okay?
It's disingenuous.
Dr. Potter?
Yes. Can you hear me?
Yes, ma'am. Go ahead.
Yeah. No, this is not the 1 in a million. This is happening all the time.
All right. So, Jaimie, give me context, because common sense says, oh, prior authorization, that's good. So you get everything lined up before, you know what is needed. You get the fight before anything's going to happen so that we can go into it clean and all on the same page. What's the reality?
It's not the reality. The reality is that doctors have prior authorizations piling up on their desk every single week. And these are for medications, these are for imaging, these are for surgeries, these are for inpatient hospitalizations. And it's taking productivity out of our workforce. It's an incredible amount of extra work that a doctor has to do to advocate for their patients for care that we believe is medically necessary. And when these prior authorizations are denied, and they're being denied at a record rate right now, it harms patients. There's serious adverse events that happen. I had a patient who was denied an inpatient hospital stay for severe preeclampsia in pregnancy, the leading cause of maternal morbidity and mortality in this country. And it's exhausting. I use the word moral injury because it really makes my blood boil when we signed up to take care of patients and we're constantly being questioned by insurance companies. Are you really doing what we're supposed to be doing for these patients?
Jaimie, Dr. Potter froze. We'll try and get her back. You had sent me a stat when you said moral injury. I was like, oh, that's an interesting phrase. What does that really mean? You backed it up for me with this AMA study that 95% of doctors report burnout from prior authorizations. Why? What do the uninitiated, the lay people, not understand about what this dynamic does that hurts not just the doctor, but the practice of medicine?
Well, when you continually deny patients care, it gets so exhausting that we look for ways to take care of patients that don't involve insurance companies. And there's doctors leaving medicine at an incredible rate right now to do cash pay practices and concierge medicine to just completely bypass the insurance companies. But that is only affordable to a very small percentage of our patients. And so as a boots on the ground physician, I have to stand in the ring and I have to fight back. But it is an incredible amount of time. It's mental exhaustion, and patients are being harmed. The more that these insurance companies are allowed to require prior authorizations, we need someone to step in and say, no, there needs to be a very small percentage of things that get checked out. Doctors are smart people. I went to school for 26 years, Chris. I've been in clinical practice for over almost 13 years now. There are smart doctors out there doing the right things for their patients, and this is just another layer of stress and burden on our system.
So the insurance answer is, and look, United Healthcare is welcome to come on and have this conversation. Jaimie, they say, well, there's so much waste and abuse otherwise. People authorize things, they double bill. This is our way of making sure that patients get the care that we can provide by making sure there's nothing extra, there's nothing superfluous that is billed on their behalf. And we do it before, not after. We're not screwing them after, which is, of course, not true either.
Oh, they do.
But we're
They
taking
do.
care of
They
it
do
before.
screw them after. Right. Yeah, I mean,
Right.
this is, so it's sometimes a surgery or a hospitalization has already occurred and they come back and say, no, we're not paying for that. And you know what that does? That puts the cost as an out-of-pocket cost for the consumer who pays these premiums to their insurance companies. And then they turn around and deny care for medications and surgeries and imaging, and they expect the patient to just pay for it. I totally understand that there is waste and fraud. Absolutely. I agree with that. Let's go after those things, but look at the profits that these insurance companies are making. I mean, the numbers just speak for themselves. And that is what has made people so angry, not just patients, but the doctors and the people who are delivering the healthcare.
Jaimie, thank you. Hey, thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget, click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.